now let's talk about some COVID-19 infections and vaccinations. It's because vaccines do actually not stop infection, but it helps the body fight off the virus. That's according to epidemiologist Salim Abdool Karim. There's been a lot of confusion with many questioning the efficacy of vaccines.
One of the critical issues is to understand that when we talk about vaccines being effective, we talk about them being effective against asymptomatic infections, against any mild clinical illness, and then against severe disease. So these are three different things that the vaccines are intended to try and impact on. But if you look at the data, there is no question that it is really useful and beneficial to get vaccinated, even though this particular variant can break through and cause mild infections. The likelihood of it causing a severe infection and leading to hospitalization is much, much lower. So those who are not vaccinated are running the risk that they will get a severe form of this disease and will end up in hospital and then will need ICU care and so on, which we're really seeing is very much lower in vaccinated individuals. So at this stage, even though people who are vaccinated are getting infected, are turning up PCR positive, are having mild symptoms like muscular pain, a bit of fever, they are not getting to the point in any significant numbers where they need hospitalization and having severe disease.
Well, the U.S. Center for Disease Control is recommending that people do not take the J&J vaccine. It's actually found it can cause blood clots. While it is rare, of course, it can be fatal. This is making people very wary of taking the J&J booster. But Barry Jacobson of the SA Society of Thrombosis and Hemostasis says the risk is extremely low.
CDC, by putting out the statement, has made people scared about taking the J&J booster, and they shouldn't be, because the reality is that the risks are very, very low, and if we identify them, we can manage those patients, but the risks are extremely low, and the risk of dying from COVID is extremely high. However, Omicron, we know that people that have been vaccinated are doing really well, that our numbers are really, really down in the ICUs and on ventilation.